Hi, this is Michelle Walker, and today I'm going to be demonstrating the ostomy care and changing an ostomy bag. So first I'm going to recite COWIPE, which is check your orders and check your patient allergies. You want to assess your patient before you begin. You want to provide for privacy. Check your orders, check your patient allergies, assess your patient, wash your hands, identify yourself to your patient, and identify the patient with 2 identifiers. You want to provide for privacy, and then you want to educate, evaluate, and explain to your patient. So first, with the ostomy bag, you want to assess the need for changing it. You don't want your ostomy bag to get any fuller than 1/3 to 1/2 full, because then you risk it leaking and causing irritation and a mess for the patient. So you want to don your gloves after you washed your hands. And as much as the patient can tolerate or is willing to help you with this process, the better, because they are going to be, they or their family member is going to be doing their ostomy care. So getting them involved is important. So you want to get, let's see, this is the ostomy bag. You want to get them in a comfortable position. You don't want any folds or creases where you're going to be doing the change. You want to, the bags are always either Velcro or clipped there, so you just kind of want to, if there's any gas in there, you want to teach them to how to alleviate that by opening and releasing the gas. Some ostomy bags have a filter that can release the gas if they do create a lot of gas. But you want to remove the pouch by peeling the top down gently by holding the skin and then peeling the wafer down. And then once you have that off, you want to dispose that in a biohazard bag. And then you want to provide your ostomy care. You want to first assess the peristoma, which is the skin around the stoma, and you want to also assess the stoma. So you're going to just be using just warm water and a wash rag to wipe the stoma off and the skin around it. Sometimes just using a very mild soap is warranted in that, but you don't want to use anything that's going to be oily or too soapy or irritating to the skin or stoma. So you're just going to be taking your washcloth and wiping around the peristoma first. You're going to wipe around the peristoma first, and then you're going to be wiping the stoma. And the stoma doesn't really have any nerves because it's the inside of the intestine flipped out. So you don't have to worry about hurting them there. But you do want to observe if there's any tenderness, swelling, any abnormal bleeding. A little bit of bleeding is normal, but any abnormal bleeding, you want to look for the color of the stoma. You're looking for a beefy red is normal. Anything bluish is abnormal. Anything black suggesting necrosis is abnormal, and those are all things that you want to let the provider know immediately, or the surgeon. So you provide your stoma care and the skin care, and you also want to, when you had checked your orders, make sure you're aware if there's any orders for any barrier creams or powders that need to be addressed first before you put your wafer on. So you want to make sure it's real dry. So you're going to pat it dry with a dry towel. And then you also want to do this at a time where they are least active in their bowels, not right after they ate or anything, because you're going to get a lot of stool coming out. So just try to change it at a time where their bowels are least active. While you're cutting out your stoma, wafer, you're going to just put a little clean 4x4 on top of that, just in case you do have any drainage. You want to measure your stoma, and you want your wafer to be about 1/8 to 1/16 larger than your stoma, so it's not rubbing up against it and irritating it. So you just kind of want to lay your measuring tool right over your stoma, and then you want to take your pen and once you have your size, and then you just want to mark your pen in a circular motion around your measuring tool, and that way you go to your wafer and you know exactly what to cut out. You know exactly what to cut out. And you're going to use blunt tipped scissors so that it's not going to be all jagged, and it's going to be a nice smooth cut when you do cut out your wafer. So you're going to cut up and then around all the way in a circular motion. If you do have any jagged pieces, just go ahead and trim that up as neat as possible. So of course I would have taken my gloves off before I went and did my stomach care and put another clean pair on. Wash my hands before I put on another clean pair. Then once you have your wafer all cut out and everything, and you have your skin prep put on, you want to set your bag, your wafer, right over your stoma, and then gently, if you had peeled the tape off, gently over your stoma, and then gently press all the way around in a circular motion until it's adhered to the skin. And you want to make sure that it's clamped off or Velcro tight there so you don't have any leakage. All while you're doing this, it is important to have a drape over underneath the, well, always drape your patient for privacy, but you want to have a pad underneath them to catch any drainage. I also bundle up like a Chuck's pad underneath where the stoma may leak, just in case we have some drainage during this process, so that they don't get all messy. And then once that's done, then I do want to mention about irrigating a colostomy, which is flushing it to clean out your bowels is the purpose of it. But you want to flush it with your sterile water, and doing that and explain to the patients the importance of doing that. Make sure that your bowels are regular, and they can do that daily if they want. Now the ostomy bag itself doesn't need to be changed for about 3 to 7 days. The actual wafer, if it's a 2-part section, doesn't need to be changed for 5 to 7 days. But if it's just a 1 unit, then it can be changed every 3 to 7 days. And then you want to document whenever you do the change. You want to document, say in the beginning when we took the old bag off, you want to look at the contents, the color, and the consistency of your ostomy bag and the contents. And you want to chart that. You want to chart the what the appearance of the stoma, if there's any swelling, any redness around the peristoma, any blistering, any possible fungal rash infection, anything out of the norm there. You want to make sure that you document. You want to document the patient's tolerance and also the patient's compliance with helping. And you also want to document if you did any education or teaching to the patient or family member if present. Okay, so you just want to make sure that they're covered up afterwards and placed in a comfortable position with their call light in hand, and then wash your hands for good hygiene. Thank you so much.